Did you listen to the Hot Breakfast this morning? Here's what you missed.
We're talking about environmental and social impact of illicit drugs. When you have a presidential candidate saying that he's going to legalize the use of marijuana or bangi, then, this is cause for concern. And in the studio today, we have Dr. Yvonne Orlando. She's Director of Public Education, Advocacy and Rehabilitation and Regional Coordination at NACADA. And we also have Dr. Faisal Suleiman, Head of Health and Social Development Pillar at the United Nations Office for Drugs and Crime. Folks, welcome to Hot 96.
Good morning.
Good morning.
Good morning.
Thank you for having us.
Thank you for being here, Dr. Yvonne. Let me start with you. Like I said, when you have a presidential candidate declaring that he is going to legalize the use of marijuana, you as NACADA, what do you say? I mean, what's the reaction?
Thank you, Jeff. Now, as NACADA, the law is clear. Cannabis is illegal. And Kenya is a signatory to different treaties, and all of them highlight the need to protect the public and particularly the youth from psychoactive substances and any form of narcotics. And cannabis is a psychoactive substance.
Yeah.
So politics happens, people say what they want to say, but you do not change the law because you're campaigning. You do not change the law because you feel like. We have to protect the public.
And yet the candidate says he will change the law, and it looks like he's getting a lot of traction, for lack of a better word. He's getting a lot of traction, especially from young people.
Yes, and unfortunately, young people are the ones who are the most at risk of cannabis use, and also of cannabis-induced psychosis. They're the ones who, when they start using cannabis, the impact to the brain is the highest. But to change the law doesn't take one person. So you cannot wake up as Jeff and decide, okay, I'm doing this because I'm the president. You will involve others who also have children, have families, have actually seen the impact of cannabis.
Yeah.
So yes, you want to protect the lives of Kenyans and not just vote for the sake.
Dr. Faisal Solomon, I mean, there are laws in place. There are laws in place. You can't just wake up, like Dr. Yvonne just said, wake up and say, oh, we're going to change the law.
Yeah, of course, it's a process. I mean, it's a legislative process. We have the National Assembly. We have a lot of things that it has to go through. But looking from a different, from the health perspective, it's important for us to understand that, cannabis does have effect on health, especially on the brain. It's a psychoactive substance, and we cannot deny that. So by psychoactive substance, it means it acts on the brain and it alters the function of the brain. So in the youth, you see that we've seen that youth who have been using cannabis, they ultimately develop what we call a motivational syndrome. It's a big word, but it's just like he's no longer motivated to work. He's no longer motivated to do other normal social activities. He becomes lonely and he has his own things to do. Over time, of course, when addiction sets in, then he will not be able to live without the cannabis, without the effect of the cannabis on his body. So long-term use of cannabis in youth gives rise to cannabis psychosis, which is serious, which is a big thing, which is serious, and in most of the cases it's not reversible. So from the health point of view, it is something that may not be the right thing to do. But I think here I would like to highlight there is a confusion between legalization of cannabis and in some countries where they did depenalization. Depenalization means you decrease, you considers the law. Say, for example, for a cannabis user, you don't send him to jail, but you send him to treatment. He needs treatment. So UNODC is working with government, with many other member states, but in Kenya, they are working with the government in Kenya, with the criminal justice actors, with the healthcare professionals to look at alternative to incarceration for people who use drugs. Cannabis is one of them. And instead of sending them to jail for a long sentence, so we send them to treatment. Of course, those who are arrested as traffickers, of course, they go through the normal course of law. But those who are users, they need to be treated from a healthcare professional point of view. They need to be treated and not sent to jail.